Ladies and gentlemen, please welcome Dr. Timothy McKnight.
Welcome, everybody. Welcome to week 2, lecture 2 of the Fit for Life series. It's good to be with you. I'm thinking about many of the faces that I know as I speak into this inanimate object here, this laptop, and I'm so happy to know that some of my good friends and others that I've met are on the other end listening to what we're going to talk about tonight. So I really appreciate you taking the time to be on this evening. I hope that you've been able to watch most of the week 2 presentations that we've provided for you. I think they're packed full of really useful information. So tonight we're going to try to highlight some of those key slides and the key points that I was trying to make, and then we'll leave some time for question and answer. So let's just jump right into it. Week 1, there was no nutritional changes, as we mentioned on the lectures that you received earlier. We're still asking you to do something 3 days a week, and we're asking you to complete the reading assignments. So this particular week 2, is about mindfulness and about awareness. One of the key points that I wanted to make is I wanted you to become aware of how fast your body changes. Sometimes we don't see the changes as quickly as we want to when we look in the mirror or we look at our weight on the scales, but our body is changing. It responds very quickly. So I wanted to give you a couple of reminders and some examples of how that happens. So these are just 2 images that I'll review quickly. We talked about how quickly the gut changes. And if I go back to the previous slide, this top image on the left is a healthy intestinal lining, and this is a damaged intestinal lining. And you can see there's quite a difference. There's a loss in surface area. These finger-like projections seem to be gone, and it impairs the ability to digest food, and it impairs the ability of the microbes to perform their function optimally. So again, this is what happens when our gut is exposed to too much inflammation. And the inflammatory triggers for this are pathogenic. So they're bacteria, they're microbes, they're parasites, they're funguses. All of these potential microbes can cause a disruption and an unhealthy gut. We have things like C. difficile colitis. We have infections like fungal infections, all these different things, rotavirus, all these different bacterial and viral infections can cause a disruption and inflammation in our gut. Then we have things like stress. We know that stress impacts blood flow, and I'll share with you something about adrenal fatigue and stress and the adrenal pathways next week. But this is crucial. Stress can actually impair blood flow in your gut and the way we assimilate food. And then there are drugs, antibiotics, anti-inflammatories, antacids, alcohol. All of these have the potential, if used excessively and for too long, to damage the lining of the gut. And then there's, of course, toxins, and this is a huge group. These are things like pesticides. They're chemical toxins. They can be toxins from multiple sources that we'll talk about again in the future. And then there are certain foods that can do these things to us. Some of you have not celiac disease, but gluten intolerance. Gluten intolerance can cause this. There are food allergies. Too much sugar in your diet can inflame the gut. The bottom line is you get these inflammatory changes. And what you're seeing in the image right here on the bottom of the screen is the intestinal cell that is supposed to digest the food particles right on the surface. So this is where the food's coming down your gut. And there's mucus secreted, and there are enzymes, and there are bacteria, all designed to help you break down these food particles and absorb them into the single units that they were intended to be absorbed as. So an amino acid or a protein is a chain of amino acids. So this tiny little dot here represents an amino acid. When you fully digest this, because you've chewed your meat really well and you've given your gut a chance to break this down, that single amino acid subunit should go right into the intestinal cell, and then it's excreted into the bloodstream I should say it's secreted into the bloodstream, where it's taken to the liver, and the liver can process it and decide where to put it. If you have an inflammatory gut and you've damaged the intestinal lining, you're not going to digest proteins, fats, and carbohydrates completely. So in this process of inflammation, there's a glue or a cement that holds these cells together and provides a barrier. And this small little yellow image here is that glue. It's called zonulin, zonulin. And it starts to break down. It breaks down like a brick and mortar. So it's the mortar in a brick wall. When it breaks down, things can penetrate through it. Things can leak through it. So now these peptides, these short chain peptides that aren't completely digested, instead of a single amino acid, maybe we have 4 or 5 peptides that are still in a chain. They leak through this site, between the 2 intestinal cells, and they get into the blood. And now the blood sees a protein or a peptide, and it's not sure what it is. And when it sees that, it causes an inflammatory reaction. So this is what we call a leaky gut, leading to further inflammation, and the body goes into overdrive. And so some of the symptoms that you'll see with this, you see often in autoimmune responses or food allergies. So we have irritable bowel, we have eczema. I've mentioned before, if you've got skin rashes that we can't identify as quickly and simply, either it's either ringworm, or you've got poison ivy, or you've got some other clear reason to have this skin rash. If you have undetected or undiagnosed skin rashes, it's usually a sign of intestinal inflammation. So again, things like irritable bowel, eczema, asthma, diarrhea, constipation, and headaches, these are all signs that there's an inflammatory bowel and a leaky gut. And then things like thyroid disorders and fibromyalgia and colitis and rheumatoid arthritis are also in this category. So these are signs to me that the gut is inflamed, that the gut is leaky. And again, the cause of this are all these things I mentioned: microbes, stress, medications, the wrong foods, and toxins that enter your mouth with the foods that you eat. So all this can disrupt the gut, and this can change rapidly. So an example of this was just showing you the gut flora, the bacteria in the gut. And this came right out of an article here from 2009. And it was, I'm just going to read this quote because that's all you really need to know. Switching from a low-fat, plant polysaccharide-rich diet, which is a plant-based diet, which we know is healthy, which we'll emphasize in a few weeks, to a high-fat, high-sugar Western diet, which is what most of us like, shifted the structure of the microbes in the gut within a single day. And it changed their metabolic pathways. And it altered the genes that they expressed. So in one day, we can alter the genetic expression of bacteria in your gut. If we eat the right foods, we're altering those genes. We're altering the metabolic pathways in a good way. If we eat the wrong foods, we can cause it to change in a bad way. I was at a conference several years ago on functional medicine, and Dr. Daniel Amen, who some of you may have heard of, was one of the speakers, and he showed us a video of a 2-year-old boy who had severe autism, and he only had 4 or 5 foods in his diet, and his autism obviously was severe. So he walked us through during this 3-day conference what he did with this young boy. By the time the boy was 5 years old, his autism was gone. He was on a morning national talk show with Dr. Amen, with his mother and the interviewer, and he was a normal child in kindergarten. And what Dr. Amen did was he fixed his gut. He fixed the inflammation in his gut with foods and with supplements and with continual follow-up. So if you can heal the gut, often you can heal the rest of the body and control the inflammation. This is an example of how quickly the gut flora can change and how the wrong type of bacteria in the gut can lead to obesity. So as I mentioned, you have identical twins. They're genetically the same person, but you put each of those twins in a different environment. So the obese twin is in an obesogenic environment. So maybe there's lots of sugars, lots of fats. There's no emphasis on exercise. Maybe there's lots of stress. All those things that you might think could trigger someone to overeat and become obese. And this is epigenetics. This is the environment triggering the expression of genes. So then what we do is we take the stool from each of these genetically identical individuals who are expressing their genes differently because of their environment, and we inject that into the rectum of healthy, lean mice. And then we give these mice access to the same amount of exercise, the same type of water, the same type of diet, and we let them progress for a few weeks. And what we see in every case is the mice that receive the bacteria from the stool of the obese individual became obese in every instance. And the lean humans' feces had no bearing on obesity in the development in the lean mouse. So this tells us that the health of your gut can contribute to leanness or obesity. And we know there are certain types of bacteria that make you more likely to suffer from obesity. So what's the solution here? The solution is to eat the right foods to correct the gut imbalances. The solution sometimes is probiotics, sometimes prebiotics, but according to Dr. Amen in the lecture that I heard, it's always about getting the people to eat the right foods and staying away from foods that cause problems. These changes happen quickly. Here's a great picture of the lining of our arteries. And you can see this furry, hairy lining of an inner wall of an artery on the left. And as it changes quickly as it's exposed to a high-fat, high-sugar meal. So it quickly becomes inflamed. And you can see the severe inflammation, the loss of these small hair-like projections in the artery on the image on the right. And directly from this article, we know that a high-fat or high-sugar meal, which is inflammatory, damages this lining called the glycocalyx, and it can take up to 8 hours to restore it. So again, within one day, the quality of food you eat can change your gut, change the lining of your arteries to a lining that's healthy or sick and diseased. So we have the ability to change our gut quickly. We have the ability to change our artery lining quickly. And we talked a little bit about nitric oxide, what a powerful and important hormone this is. I'm sorry, not a hormone, it's a neurotransmitter that causes blood vessels to dilate. And as we age, many of us make less nitric oxide, not because we age, but because of epigenetics, because of the environmental variables that we introduce into our diet, the stress, the lack of exercise, the poor dietary intake, all those things, too much alcohol, too much tobacco, all those things can affect your ability to make nitric oxide. This is showing you where nitric oxide is primarily made in the lining of arteries. When you're young, you can abuse your body. You can eat the wrong foods. You can smoke. You can drink too much alcohol, and you'll still make adequate levels of nitric oxide. But if you continue to make those lifestyle choices, eventually your ability to make nitric oxide becomes severely impaired. And in this image, you see the 60-year-old who's only able to make 15% of the nitric oxide they could make when they were in their 20s. These are the men with erectile dysfunction. More importantly, these are the men or the women who are at risk for a heart attack or a stroke, because if you can't dilate the blood vessels, you become more at risk for those conditions, as well as an increased risk for high blood pressure. Then we talked about telomeres, and this is how we can tell what someone's physiologic age is. We look at their chromosomes. We look at how quickly the end of their chromosomes shorten. And the speed that you age has to do not so much with your genes, but more to do with your surroundings, your epigenetics, the lifestyle choices that you make. So this telomere is the end cap of a chromosome. We have 23 chromosomes. Every chromosome has these end caps, and it's similar to a shoelace. So this is the plastic tip of a shoelace is similar to the telomere on a human chromosome. And every time the cell divides, there's a small snip of that telomere, and it becomes a little bit shorter. When they're showing you the progression of these telomere shortenings with each division of the cell. And when we get down to this point, where there's not much more telomere that can be shortened, just like the plastic cap on a shoelace. If you cut the rest of that cap off, now the shoelace starts to unravel and it starts to age quickly, and humans age quickly. And you can see when that happens, when someone's in the last 6 months, 3 years, 5 years of their life. You can see how quickly they become less active, how much muscle they lose, their inability to walk without keeping their balance. All those things that predict that someone's getting close to death is a sign that the telomeres are shortening and starting to unravel very quickly. So we know that telomeres, from this study, they do a number of things and they can impact how fast we age. And again, this is right from this article. Everything I'm putting up here is a direct quote. Telomere length shortens with age. Progressive shortening leads to cell degradation, death, and mutations, which can affect the health and lifespan of the individual. Oh, let me go back to that most important statement on that slide. The rate of shortening, or how fast you age, can either be increased or decreased by lifestyle factors. We are empowered to slow the aging process down if we're aware of the lifestyle issues and habits that cause us to age quickly. So accelerating the shortening of these telomeres can increase the pace of aging. So we want to slow this down. We can't do anything about our chronological age, and we can't do anything about our genetics. But these other factors that impact how quickly you shorten those telomeres, how quickly you age, are completely within our control. We can control much of our environmental factors. We can control our social and economic status. We can control our exercise routines. We can control our weight, and we can control our diet, and we can control whether or not we smoke. So if you want to shorten your telomeres and age quickly, these are the lifestyle habits that you would do on a regular basis. All the things we know aren't good for us. If you want to slow down the aging process, then eat a high fiber diet, eat polyunsaturated fats. Low protein diets are also a way to slow this down. Where do you get these foods? We're going to talk about this, but you get them from fruits and vegetables and nuts and seeds and beans and whole grain fibers. We have to exercise. Exercise will slow down the aging process. We need a diet rich in omega-3 fatty acids, a diet rich in antioxidants, and a diet that's low in calories. We're going to talk a lot about that in the next few weeks. So how fast can we heal? Well, I just showed you that your gut can heal fast. Your endothelial lining can heal quickly, that your metabolic rate, your metabolic health, your cholesterol levels, all those things can change very, very rapidly if you put yourself in the right environment. Our brain can also heal quickly, and this is called neuroplasticity. It's constantly changing. We think we're stuck a certain way. We think we're wired a certain way. We talked about that. We're going to talk about rewiring our brains next week so that we can be more effective and successful as we try to change behaviors. Our hormones can clearly be enhanced with the right types of lifestyle changes. Our musculoskeletal health can improve. I'll show you when we talk about strength conditioning that nursing home patients can increase their strength, can increase the quality of their sleep just by exercising their muscles as they're sitting in their chair all day. Cardiovascular health can heal quickly. So the question is, can we still live healthy if one of these symptoms has failed or is compromised? And we'll talk about this a little bit more next week. But to really be fully healthy, we need to be balanced in all these areas. Now, some of us may be limited because of a stroke or another condition, and we can't do all the things we once did. But the more we address our lifestyle, the more balanced all of these systems will be, and it will be in our favor to help us age slower and have more strength and stamina as we get older. So then we talked about readiness to change, and are you willing to pay the price to change? And we talked about this verse in the Bible, basically saying if you're going to make some changes and you're serious about making changes, you need to count the cost and realize it's going to require something different from you. You're going to have to dig a little bit deeper than you have before if you really want to see the changes. So we talked about the steps of readiness to change. And my question here is, I really don't even like this slide. I'm not sure why I keep putting it in here. But we should all be at the action stage. If we're not ready to change, there should be no reason for us to be taking this series of classes. So we should be at the action stage right now where we're starting to do things to improve our health. But why is it so hard for many of us to get to that point? Why is it so hard for us to change? Now, at the end, I'd love to hear a discussion on this. I'd love to hear your thoughts, because most of us know what we need to do. But some of us, we have to get to that point where we're willing to make the sacrifices. We're willing to do the hard things. And I'll tell you that I've struggled with this a little bit myself. In the fall Fit for Life class, I had to admit to the class that I had gained weight and I was heavier than I'd ever been. And so each week I checked in and I told the class how much weight I'd lost and what I'd done. I lost probably 16, 17 pounds during the fall class. Well, then over the holidays and for other reasons, I gained about 4 or 5 pounds back. Instead of losing it, I gained it back. I'm finding that it's really hard for me to get my mindset ready to change because I know it's going to require some things from me. And I'm just not sure I'm there mentally. But I realized the light bulb went on tonight as I thought about this. What's going to make me ready to change is telling you this, being open about this, and telling you next week, I will show you how much weight I've lost. Because knowing I'm accountable to you, it's going to make me more willing to change and do a better job. So that's the value and importance of having a coach or someone that you can report to, who you're going to commit to saying each week, this is how I'm doing. So are you ready to take a look at yourself? Do you really know what's going on around you? You have to be honest with yourself. You have to have the courage to face your flaws. I was able to face my flaws and realize I've gained 4 or 5 pounds. And I mentioned this to Kelly today, and I realized I'm going to have to confess this to you guys if I'm really serious about this. And she sort of helped me have the courage to be able to do that. But that's the value of a friend, a coach, someone you can talk to and get support from. So my question is, are you really aware of what's going on around you? So I'm going to step out of the slide deck here for a minute. I want to show you a short video that I think will illustrate this point really nicely for you. I just have to find it.
The test of selective attention. Count how many times the players wearing white pass the basketball. How many passes did you count? The correct answer is 15 passes. But did you see the gorilla? This video is
Okay, where do here we go. Okay, so I hope some of you I know are driving, you're doing other things, so you may have missed that video. But the point was, as these people in black and white shirts were passing the basketball, were focused on how many passes of the ball they made. There was a gorilla that stepped in and was pounding his chest and then walked out of the scene. If you're really paying attention, you normally wouldn't see the gorilla, but the gorilla's there. So the point is sometimes our attention is very selective and we're not aware of what's happening around us or to us. And often we're not very sensitive to the needs of other people. So let's talk about, review the origin of behavior, because as we go on to heal, we have to understand what causes our behavior sometimes to be flawed, and why we do some of the things we do that make life difficult for us when we're trying to improve our health and change our behavior in a positive way. So the origin of the behavior really, I asked the question, do we do things based on how we feel, what we know? Is it relationships? Is it circumstances? And our behaviors have really been shown to be based on our emotional states. Our thoughts trigger our emotions, and it's our emotions that drive behavior. Another way to look at this is our emotional states are not some nebulous concept. Through the work of Candace Pert, and who is a molecular biologist, and Bruce Lipton, who is also a physiologist who's done some great work, and he's a well-known author, we know that these emotional states are not just this nebulous idea, but every emotion we believe is associated with a specific chemical, a specific neurotransmitter. So whether the emotion is love, anger, lust, fear, victimization, craving, whatever that emotion is, there's a unique neurotransmitter that's linked to that. And when that neurotransmitter stimulates a cell, it changes physiology, which changes behavior. So again, our thoughts are really a belief system that we develop at a young age. And once we have these belief systems entrenched into our mind, it impacts our perception of the world. So the example I gave to you was a room full of adults who, when I walk in their room with a cloth bag and I dump out a 4-foot live rattlesnake, their belief system that you have is that this is dangerous, this could kill you, this could bite you, this could be a very bad situation. So immediately your neurochemistry causes a hormone response, and it changes your physiology immediately. It shifts blood flow to certain parts of the brain. In some ways, that makes you dumber. It makes your body more capable of a physical response with muscle blood flow to the muscles, but a loss of blood flow to your gut, so you don't digest food well. You don't have blood to the reproductive system because you don't need that at that point. And this quickly changes your behavior. So you immediately respond to this, and you're out of the room. You're moving but by the time that this snake hits the floor, you've already had the response. If we change the audience, but we have the same stimulus, and we put 2-year-olds in that classroom setting, because their belief system is not yours, it's not an adult's, they see this as a toy. They see the rattle as something they want to touch. The tongue sticking out is something they might want to see if they can touch it with their finger. So their physiologic response and their behavior is completely different because they have a different belief system. They're telling themselves a different story. And I think that's a really good illustration of how powerful our belief systems can be, for good or for bad. So again, our thoughts trigger emotions, and it changes our biochemistry. Now, those emotions, those neurotransmitters, only last for 90 seconds. They flood into our bloodstream and go to our nervous centers and into our cells. And in 90 seconds, the body is capable of removing all those neurotransmitters. That's what it does. But if you continue to think about that situation in the classroom, and why would he put that snake in there? Doesn't he know that could kill somebody? That was so inconsiderate. I was scared to death. I'm going to tell my husband about this when I get home. And you have those thoughts over and over again. You're continuing to release the neurotransmitters, which continue to change your biochemistry. Is that something you really want to do? Is that something that's going to be helpful to you? So we have to start to change our biochemistry and our emotional responses by reprogramming our belief systems, our scripts. So we can become addicted to these chemical responses that we get from certain emotions. And if you look at these examples, a craving for carbs, a fear of victimization, a thrill of gambling, what are these words? They're emotions: desire, craving, fill, thrill. These are emotions that trigger the responses that we get, and often these responses are not in harmony with good health. So the belief systems we're talking about is basically the way our brain is wired together. And I showed you this study that is crucial to this concept. And the key age is from a toddler, from the age of 2 to 6, their primary function in learning is to assimilate as much information as they can without questioning it. Just believe it. This is the best time to teach a child 3 different languages. because they'll pick up on it, they'll learn quickly. They're not hung up on the early reasoning and the critical thinking that an elementary school child would be or a teenager would be. It's just downloading information. But if the information is not healthy for us, if it's harmful for our self-esteem, or tells us a story about ourselves that isn't true, but is harmful, then we don't question it. And that becomes part of our belief systems. It becomes the lenses that we see the world through, and it impacts the interpretation of every event in our life. So this is not about blaming our parents or other people, but it's about understanding what drives us. It's about understanding those hot buttons, understanding those insecurities, where they come from. And it doesn't just happen from the age of 2 to 6, but this is the predominant time when this can happen. You can believe somebody else's interpretation and story about you at any age if they have that kind of an influence on you. But for these children, this is a critical time when assimilation of information is their primary function of their brain. So if the belief systems, if these are the things that you hear as a toddler, the negative beliefs, imagine how this person is going to perceive the world and the events that happen to them as they go through the world. And then you look at the belief systems that are developed in a toddler who hear these messages when they're growing up. You're going to have completely different outcomes, not only in their emotional states, but in their responses to every stress in their life. And this is going to change their genetic expression. This is going to change their relationship with food. This is going to change how they relate to others. And it's going to change how they manage stress in general. So these are powerful nerve connections that are made in the brain that cause us, some of these are good, some of these are bad. And it's about identifying and recognizing the power of these belief systems. So when these belief systems are triggered, then what happens? Well, when you feel anger, when you feel hurt, attacked, inferior, or dark, anything negative, I want you to think of this. I want you to think of, what are you afraid of? And when I say that, you're like, this doesn't even make sense. But I know this is true for me. And specifically, when I feel the emotion of anger, I'm afraid of 2 out of the 4 triggers that I'm going to show you now. Some of us are afraid of being rejected. If you've been rejected at a key point in your life by a parent, by a sibling, by a girlfriend or a boyfriend or a loved one, if you felt rejection in your life, that becomes a hot trigger that sends you into a dark place when you perceive you're being rejected once again. What about abandonment? If you were abandoned as a child in any way, maybe you weren't abandoned, but that was your perception, that becomes very difficult for you, because this tells you that your worth is you don't have great worth because of this feeling of abandonment. What if you're afraid of loss of control? How about if you're afraid of failing? Now, when I lose my temper, it is it's number 3 and number 4, and it happened to me today. I didn't blow up my temper, but I could feel my anger starting to rise as I wrote a long answer to a colleague about a clinical question. And as I went to hit the send button, I had to go back into that program, and then I thought it was gone. I thought it was erased. I was not happy because I had a lot to do, and that 15 minutes seemed like it was now wasted. And so I had felt like I'd lost control of the situation. And that's when I felt my emotions start to raise. My blood pressure probably went up. My heart rate went up. I was feeling tense, and I had to go reassure myself that it was okay. So these reactions represent our program belief system. So my belief system was, in this situation, I just wasted time, and now I'm going to have to do this over again, and I don't have time to do this over again. And you can see the story I'm writing. Okay, so we're talking about these immediate nerve reactions because my brain was wired to feel like when I'm losing control of a situation, I'm going to lash out, I'm going to react in a way that often is not healthy, because that's the way the brain has been wired. That's something that I have to rewire. Now, this is a great illustration, a great model from Viktor Frankl, who was, I think he was a Jewish prisoner of war individual in the World War II concentration camps. And he wrote several well-known books, but he talked about this space between stimulus and response. And this space is the power to recreate and reprogram. And what we need to do when we start to feel these emotions that take us into a dark place is push the pause button and ask ourselves, is this worthy of this reaction? When I tried to send that message today and it didn't go through, I skipped right over the pause button. I went right to the response. If I had pushed the pause button, I would have said, okay, this doesn't appear to be working. I'm sure it's still there somewhere. Let me go get somebody that can help me do this, which is what I did. But I spent about a minute jumping to the response section, which was changing my physiology. So all of us need to take a step back, whatever the trigger is that takes us to this dark feeling, this feeling of anxiety or fear or darkness or feeling attacked or victimization, any of those negative emotions, we need to push the pause button and really start to ask some penetrating questions and realize that this is probably a perception that's not as true as we think it is, and we can quickly change our physiology if we back through that. So my question with this image is, how heavy is this glass of water? Doesn't look too heavy. Most of you could hold your arm out and hold up this glass of water. So how heavy is it? Well, it depends on how long you hold on to it. If you hold on to it for 10 seconds, no big deal. If you hold it for a minute, your arm might shake a little bit. If I told you had to hold this glass of water up for 3 hours and not move, it would be almost an impossible challenge for most of us. So my question is, how long do we hold on to our burdens and belief systems before we just lay them aside and write a new script? Because some of us really struggle with that. I still struggle with it, but I'm getting better because I'm starting to recognize where those triggers are and what's happening, which is what I did today. Had I reacted like I would have 10 years ago, I would not have pushed that pause button and got the help. I would have probably had more issues with feeling out of control. So what happens when these minds collide? When you make a conscious decision to behave a certain way, but your subconscious mind, where the belief systems are, takes you someplace else. Well, this is where you feel frustrated. This is where you feel like goals just don't work. I set this goal, and for some reason, I'm in a dark place. I'm in a place that doesn't want me to, I don't want to exercise. Instead of eating vegetables today, I'm going to have a dozen cookies and a bowl of ice cream because I just don't like how I'm feeling. Nobody's going to tell me how to eat. Well, those are belief systems. Those are perceptions based on old patterns of nervous system connections in our brain. We have to realize where those come from, and those have to be reprogrammed. Until we reprogram those, it's going to take effort. We're going to have to push the pause button before we can really start to heal at this level. So we talk about the fear of change or being permanently stuck the way you are. Change is very, very difficult because you don't know what you're going to be as you come out the other end. If you lose weight and you get thin, are you going to like yourself? Is somebody going to tell you you're vain? Is somebody going to tell you you're conceited? Can you live with those kind of comments? But being permanently stuck the way you are now, most of you are taking this course because you want to improve your health. You want to change. So being permanently stuck is not an option either. So these are the ideas that come to mind when we think of change. Fear, anxiety, unknown, unpredictable. And then we have this feeling of permanence, which is more safe. It's predictable. It means we're never going to change the situation in our life, but at least we can predict the future. This is the enabling pattern that you see with drug addicts and alcoholics who often continue on this dysfunctional lifestyle because that's all they know. And it's too hard to try to change. There's no way I can live without alcohol. There's no way I can live without drugs. So I'm going to continue it. And we talked about distinguish between what we think we see and what life really shows us. So we talked about these perceptions and what causes our discomfort and stress. It's not the situations, it's the perceptions and the interpretations we make in the world around us. So these are stories that we write based on our belief systems. And if our belief systems are flawed, if they're harmful, then we have to write new stories. That's what we're going to talk about doing next week. I gave you this illustration of being perceptive, this exercise where I had you look for 30 seconds for all the red objects and then close your eyes and tell me all the objects that were green. Well, the point here is we often see what we're looking for. We're blinded to everything else because we're looking through life through our own lenses, and we're not always as perceptive as we think we are. So when you look at this picture, the question is, what do you see? And the answer to the question is, it depends on where you look first. When you're having a bad day, where do you go first? Do you go to a trusted friend who's going to encourage you? Or do you go to the refrigerator who's going to comfort you? How about this? Now, when we have a hard time making sense out of our life, we think we understand something a certain way and it just doesn't come together that way. This will drive us insane. And that means we're probably not perceiving things as they really are. And we may need some help by a professional or a friend or someone capable of helping us back up a little bit and seeing the world as it really is. So we have lots of choices with these perceptions that we know don't make sense. And this is the list of the different ways that we can go with this. So then I ask you to how these perceptions affected your behavior and what do you most need to change. And I hope you're completing these assignments. We get in this infinite loop of powerlessness when we focus on the past or we worry about the future. We can't do anything about our past and we can't do anything about the future. These both leave us in a state of anxiety and powerlessness. So we have to be very careful that we don't spend too much time in either place. What we need to do is be focused on the present. You may be 60 pounds overweight, but if today you eat healthy, today you're a trim person. You may be not someone who doesn't like exercise, but if today you get out and walk 15 minutes, today you're an athlete. And we need to look at the present and live in the present and be focused on the here and now. So we talked about, well, how do we begin to do this? And sometimes we just have to learn to listen. We have to pay attention to the here and now. This exercise is difficult to do, looking at the mountains and just focusing on this image without letting your mind drift and wander for 30 seconds is difficult to do. And hopefully you've all done that and realized that, yeah, my mind was drifting and had to bring it back. So it is time to listen. Our body tells us where we are long before our brain does. You see this in children who go into kindergarten. You see it in teenagers. You see it in people who are anxious about something difficult. They've got a dentist appointment. They got to give a speech in public. And our body will tell us where we are long before our brain does. We have to listen to that. When we get a headache, when we have stomach pain, when we get diarrhea, often these are anxiety provoked, and the body's trying to tell us something. It's trying to say, you're writing a story here that you shouldn't be writing. You're bringing too much stress on yourself. Just do your best and roll with it. But we sometimes miss those signals and we create additional stress that we don't need. We talked about emotional eating and how easy it is this is to do. And the question is, when you eat emotionally, when you've had a bad day and you have those taboo foods that you know you probably shouldn't have, do you feel better? Well, the answer is, if you're like me, yes, you do, for about 10 or 15 minutes. And when everything's done, and now you're feeling the food on your hips and on your belly, and you're feeling the fatigue that often comes with it or the bloating that comes with it, you don't feel better. So this is what happens when we're distressed. So we have to really start thinking about, when we eat emotionally, why we're eating. If it's an emotional issue, then we need to deal with the emotions and not use food as a substitute. Then we gave you this eating mindfully exercise where I ask you to chew the food really well and to smell it and to taste it and pay attention to what's happening to your salivary glands as you do it. Pay attention to what's happening to your stomach, the rumblings in your stomach, and the waking up of your intestinal tract, and chew it really well and disengage yourself from that fork or spoon that seems to be attached to you until food is gone. If you put the fork down out of your reach and chew the food, the fork will still be there. It's not going away. But some of us are afraid that if we do that, we might not get to finish our meal. And that's not eating mindfully. So the point of this lecture was to remind you that our body chemistry changes quickly because of environmental triggers. A secondary point was that question is, then why are we so impatient with ourselves? Well, I think the answer to that is we're looking at the wrong outcomes. We're letting the scales tell us if we've done a good job. We're letting our muscle growth tell us if we're doing a good job. We're letting our body image tell us if we're seeing the results that we want. And if we don't like them, the assumption is, well, nothing is changing. And that couldn't be further from the truth. You can change your body chemistry within 24 hours in almost every system of your body, but you have to be patient and you have to stick with it until those obvious external visual changes start to appear in front of the mirror. So what are the stories that we write when our change is slow, when we've been eating the right foods for 2 weeks and we haven't seen the scales move? What is the story that we write? I think that's worth thinking about and chewing on, because often those stories are not consistent with the truth. And we start to make judgments and assumptions, and we go into places in our mind because of our perception and interpretation that are not helpful. So we need to be patient because nature teaches us patience. I will explain this next week, but the law of the harvest for a plant to grow and be harvested is nature's perfect example of patience. Things don't happen quickly in nature, but they happen consistently and predictably because nature always gets it right. We need to learn from nature and do the same. We need to patiently stick with our plan. So are you ready to change? We talked about the origin of behavior, and we talked about perception and reality. And then finally, can we really be honest with ourselves? I don't want you to be honest with yourself to the point that you're hard on yourself and you're critical and you feel like a failure. I want you to be honest with yourself enough that you gain new insights that help you to understand why you've been doing what you've been doing, and more importantly, how to change it to be more beneficial for your health and your overall state of mind. So the assignment was to avoid eating out for this week, to drink plenty of water, 12 ounces 6 times a day, to hydrate yourself first. Most of us are dehydrated. Many of us mindlessly open up the refrigerator and we're looking for something to hydrate ourselves. And we might get a jar full of applesauce, or we might pour some orange juice. But really what our body is telling us, if we listen, is give me a glass of water, I'm dehydrated. You don't need those calories, you need the hydration in those foods. So start with that. And then completing a 24-hour fast is something some of you are probably feeling anxious about, but it really isn't that bad. And you're going to learn so much about hunger and satiety, and you're going to learn about mindfulness as you do this. And in the workbook, in the journal on page 107, I've explained the benefits of fasting and why I want you to do this. This is about thinking about what you're putting in your mouth and realizing many times you're putting food in your mouth without really being aware of it. Number 2, it's about giving your intestinal tract a break. And number 3, it's about reprogramming your body so that you have more control over your appetite. As you do intermittent fasting and as you complete a 24-hour fast, you will change the hormones leptin and ghrelin in your brain and in your intestinal tract, and your drive to eat will be diminished. And you'll be able to go sometimes a day or 2 without really thinking I'm starving. And that's actually very healthy for us to do. And I'm not going to take any of you to that point and not make that a requirement, but I want you to understand, for those of you who are serious about losing a lot of weight, you may have to get to that point where you're fasting a couple times a month for 1 or 2 days where you go without food. So next week, we're going to talk about intentional healing, and we'll talk about these wonderful, beautiful messages that nature teaches us about healing. We'll talk about order and sequence, harmony, independence and interdependence, the biology of belief, and we'll tie in some really important medical or physiological concepts. We'll talk about adrenal fatigue. We'll talk a little bit more about obesity, because these are all important topics that will help you to understand how to change the way your brain is wired so that your behavior is more consistent with the permanent changes that we're trying to all achieve. So that's the lecture. Now let me back out of this so we can maybe take some questions, and maybe I'll be able to see them if I do that. Okay, I think I can see questions. If anybody has any, I'd be happy to entertain them. So the thought, I thought we should eat a high protein food. We're going to talk about this, and you're going to be able to calculate how much protein you need based on your weight and your circumstances. But the idea here is we're not carnivorous animals. We're not animals that are supposed to be eating the flesh of other animals in excess. So if we eat a high protein diet, it can cause us, it can accelerate the telomere shortening, accelerate the aging process. It can cause a breakdown and destruction in joints and muscles that can actually backfire on us. So we'll illustrate this really well when we talk about strength conditioning. We talk about your nutritional requirements. But my point is that we probably should not be eating protein in excess. So how much of our diagnosis, such as heart disease, diabetes, high cholesterol, is due to the epigenetic versus genetics from our parents? Great question. Let me tell you that that is a wonderful question. So heart disease, if you have heart disease in your family, a first-degree relative, so your father, your mother, or a sibling, and they have a heart attack before the age of 65, that significantly increases your risk of heart disease, but it doesn't guarantee it. And the big variable there is epigenetics. It's what you do with your choices with food, with your choices with exercise, and how you manage stress. So for most people, it predicts a problem unless you change the environment, unless you change your lifestyle. Diabetes is very much the same way. Type 2 diabetes, adult onset diabetes, does have a strong familial inheritance pattern, but only if you eat the wrong foods, only if you become overweight. If you eat the wrong foods, keep your weight at an ideal range, your likelihood of developing type 2 is almost zero. So, and cholesterol is much the same. Most of us can have excellent cholesterol levels with a healthy diet. Some of us have genetic predispositions, and we can't change that much. But I'll talk to you about this more in the future. High cholesterol does not always predict that you're at high risk for heart disease. So I hope that helps to answer that question. Can we drink during the fast? Thank you for asking. Yes, I do want you to drink water during this fast. If you're someone who drinks a lot of caffeinated drinks like coffee or Diet Pepsi, my recommendation is that you don't go cold turkey off the caffeine, because you can get a pretty bad caffeine withdrawal headache, and I don't want you going through that. So I'm trying to get you away from calories, and I'm trying to encourage you to drink water as much as you can. But the key here is we're going to not put food in our mouth. So thank you for that clarification. How many hours should you do for intermittent fasting? Most of the experts say 18 hours a day is ideal. So you have a 6-hour window to eat. So for me, I find that eating around 1 o'clock and 7 o'clock in the evening is the most convenient time. But you can pick any 6-hour block of time that you want. But the more important question is, how often should you do this? It's like anything else. If I train my muscle to do the same thing over and over again, initially it's going to be sore and respond very well with the training. But eventually the response isn't going to be there, because my body will figure that out and there'll be no more change or improvement. The same thing happens with intermittent fasting. You should break this up. Once a week, you should probably try a 24-hour fast, and then do 18-hour fast every other day. Maybe once a month you do a 2 or 3 day fast. In other words, throw your body off a little bit. Make it a little bit unpredictable, and the body will have to respond because it never knows what to expect. This is the way our ancestor ate 200 or 300 years ago. Food wasn't guaranteed every day, and they survived, and they survived well. One day they get some walnuts and blueberries. They don't have anything for a couple days, and then they get a fish out of the river and they eat that, or maybe they shoot a rabbit and they eat that. So we're definitely designed to be able to survive without eating 3 times a day, and that's just an unfortunate misnomer that's developed because of the society norms that have developed. So hope that helps you. What's the difference between plant protein and animal protein? The difference is that animal protein has more saturated fat in it, which we're trying to limit. Plant protein is always healthy for us because we are, and we'll talk about this, we're primarily plant eaters. If you look at the structure in your mouth looks more like a cow, as far as your teeth structure, than a cat. A cat's mouth is full of canines that rip and tear flesh. We have teeth that are incisors, and we have molars that cut and that chew. So we should be chewing foods. We should get most of our proteins from plant foods, but I'm certainly not saying you have to be vegetarian. I think there's nothing wrong with having a hamburger or fish or pork chops or a steak every now and then. I'm just saying most of us probably eat more than we should, and we need to be careful. So those are great questions. I appreciate you guys asking those, and it was good to have you guys all on the call tonight. I'm really honored. Like I said, I know many of you. I feel very honored that you're with me and you're here taking this course with me, and I hope that it gives you everything you're looking for. We'll be working on week 3 here in the next few days, and look forward to getting this sent off to you. So have a great evening and good luck as you go forward, and let's stay in touch through Facebook.